Okay, we're back with part 6. We're talking about the basics of the brain, blood supply to the brain, and cranial nerves. We're looking at my blog, myroadtomedicalschool.blogspot.jp. If you want to check it out, look at the blog post of the same name. So we were looking at, we're in the 70s now, and we're now on number 74, talking about a brain aneurysm. Can result in what? What can happen if you have a brain aneurysm? Well, you can have an ischemic stroke, for example, as a result of a cerebral embolism. So we just talked about the types of cerebral aneurysms, for example, a fusiform, or like it's an outpocketing of the vessel, a berry, which could be like in the middle of the weak point of a bifurcating artery, and then there's a saccular type, which looks like a bulge in the like a P in the center of an artery. So number 75, a transient ischemic stroke. What is that? These are mini strokes and are a warning of blocked arteries, etc. 76. Some points about the rupture of a saccular aneurysm. It will bleed into the subarachnoid space. Where will it bleed? Subarachnoid space. And this will result in what type of hematoma? Subarachnoid hematoma. And some of the possibilities where this could happen are the anterior, middle, or posterior branching points. Okay, on my blog I'm looking at a basilar bifurcation artery splitting into the posterior cerebral artery. I'm looking at an image of a berry aneurysm and how it can occur. So just remember they can happen they're very likely to happen at the bifurcation of the arteries, especially at the basilar artery. Number 77, what is a carotid endarterectomy? A carotid endarterectomy, I misspelled it, is a surgical procedure used to reduce the risk of stroke by correcting stenosis or narrowing in the common carotid artery or internal carotid artery. And endarterectomy is the removal of material in the middle or the end of an artery. So this is not always a good idea to remove it, because pieces can break off and then it becomes a detached embolus. Atherosclerosis causes plaque to form in the carotid arteries, usually at the fork, where the common carotid artery divides into the internal and external carotid artery. The plaque can build in the inner surface of the artery, which is called the lumen, and narrow or constrict the artery, and then pieces of the plaque, called emboli, can break off and travel up the internal carotid artery to the brain, where it blocks circulation and can cause death of the brain tissue. So one important point: if an artery is completely occluded, will it reduce or increase the risk of stroke? Actually, it will reduce the risk of stroke, but if there are symptoms of a transient ischemic stroke, then you might want to take some action, for example, to put in a stent. So there we have it, a quick review of the basics of the brain, blood supply to the brain, and the cranial nerves. Tune in next time as we talk in more detail about the cranial nerves. Thank you very much.